We're presenting here at the Lugano International Conference for Malignant Lymphoma, a single institution phase 2 study investigating rituximab in combination with pembrolizumab in patients with relapsed follicular lymphoma. It's important to note that these were patients that were rituximab sensitive, and how we define that is they at least achieved a partial response and maintained their response for at least 6 months during prior rituximab containing therapy. This was a relapsed population. Most of the patients had had a median of 2 prior lines of therapy. The study schema essentially was a phase 2 open label. They received 375 milligrams of rituximab on days 1, 8, 15, and 22 of cycle 1. And they received pembrolizumab starting on day 2 every 3 weeks for a total of 16 doses. The primary endpoint was overall response rate. They had secondary endpoints including progression-free survival, overall survival, duration of response, and safety. We're presenting the interim results based on a pre-planned analysis looking at 20 evaluable patients for for efficacy and 30 evaluable patients for safety. It's important to note that the overall response rate was 65%, but the majority of these patients had achieved a complete response rate, and the responses appear to be quite durable, albeit with 8 months of follow-up. We have not reached our overall survival or median survival endpoints at this point, again with short follow-up. We have observed no deaths. In regards to safety, we've also observed no grade 4 adverse events. The grade 3 were very infrequent. The immune-mediated adverse events, again, were infrequent, mostly grade 1 or 2. But we did remove 4 subjects from the study due to recurrent grade 2 immune-mediated adverse events, including 2 for diarrhea, 1 for rash, and 1 for pneumonitis.